So it's kind of like riding a bike. You know, your mom, dad, your uncle can tell you, this is what we're going to be doing. But ultimately, once you get on that bike, you need training wheels. Like you're unstable. But with time and practice, your brain's figuring out, this is what I have to do to kind of be on the bike and move forward. And once you're able to ride a bike, if you haven't rode in 10 years, you can get back on a bike and ride it again.
Right.
So your brain has the capacity to remember what we're asking it to do.
Welcome to Lived In by Zoe Therapy Services. I'm your host, Micah Faye, and I'm excited to share with you a community of experts who specialize in helping you feel fantastic. That's what Lived In aims to be, an online hub for DIY wellness led by the experts and curated by folks who care. In this wellness series, I interview Richmond community leaders, vendors, and healers to empower you with a toolkit, one filled with healthy practices to make every day just a little bit better. So welcome to Lived In, your online comfy couch surrounded by friends and supported by experts. Come on in. We're excited to have you. Hello everyone, welcome to Lived In. Today I am here with the wonderful Miss Cheryl Desvernine, who is a neurofeedback practitioner. So, Miss Cheryl, please explain to me, as though I am a sixth grader, what neurofeedback is.
So neurofeedback is a tool where a person can get instant feedback information regarding what their actual brain activity is doing. So it's similar to if you are on a diet and you step on a scale, you see a number and it gives you information. Am I closer or further away from my goal?
Yeah.
Only neurofeedback is very instantaneous. It's in the moment. And so our brain is getting information about what it's doing and what we want it to do.
So what's the process like? Can you walk me through the moment I walk into your office till the moment I leave, sort of what happens when I come to you for neurofeedback?
So typically everybody has kind of what's an assessment done, a discussion, what symptoms they're struggling with, have they had panic, sleep issues, digestive upsets, pain, all kinds of different symptoms.
Yeah.
And then after we get a full assessment and know more about if they've had a head injury, those kinds of things, then we start talking about neurofeedback as an intervention.
Okay.
And there's a couple of different ways people can do it.
Yeah.
Some people come in and we start training based on their symptoms. Mm-hmm. So if a person has anxiety, typically that's in the rear part of their brain and there's too much activity. So I can start training that way. Other people get a full brain map, which is basically getting an idea of what's going on in the brain at all sites. There's 19 sites that we take information from.
Wow. Okay, and so from what I know, sort of during that brain map, the person wears a cap and is asked questions. And so can you walk me through that process? What's the cap for? How does that work? And what are the activities that the person's going to be asked to do once they get into your office?
So the cap is made out of a fabric and it's got some ports in it, which are little electro ports. They sit on top of the head in the areas where we're trying to get information about the brain waves.
Yeah.
And so there's 19 to 20 separate ports at different specific parts of the head. The cap is plugged into the amplifier, and then the amplifier is plugged into the computer. So our brains are both chemical and electrical. And so what we're measuring is the electrical part of the brain. And because it's so small, it's like a millionth of a volt, we have to amplify it like people do with their guitars to better hear the sound of the brain, or in this case, to see what the waveforms are like in different areas.
Huh.
And so once the cap's on, comfortable and measured, it gets some electrogel, and that helps conduct the signal that we're feeding into the computer.
Okay.
And so the tasks are very simple. I don't really even call them tasks, but it's a minute of eyes closed,
Yes.
a minute of eyes open, and then, for example, listening to me read out loud and trying to remember specific information, or 5, 4, 3, 2, 1, repeat what you heard me say,
5,
digit
4, 3, 2, 1.
recall.
Okay. So you also, work full-time as a counselor and a therapist. So I'm curious about how you got to neurofeedback, because it sounds a little bit like science fiction when you first hear about it. So what was your path to getting to neurofeedback?
So I've practiced now for about 30 years, and in doing so, you kind of come to a point as a therapist where you realize that counseling and medication can only go so far. It only can do so much. People are still struggling. People still suffer despite, what we have. And I was first exposed to neurofeedback probably in the late 90s. The psychologist in Fredericksburg had it, and I got a little bit of information about it. But it wasn't until around maybe 2015 that I saw it at a conference and got intrigued, talked to some of the people who were doing it, and got more information.
Yeah. What intrigued you, though? I'm genuinely curious. Like how, because you're so smart. I get to spend a lot of time with you, and I know how smart you are. I think if I saw that on a stage, I would be like, well, that's some magic. Not like, well, that's some science, So how did you get there?
Well, the person I spoke to spoke specifically about ADD and ADHD and in my family, and I've had loved ones that have struggled with that and seen them take medication and not really like the medication, how they made it feel. They didn't feel like it was completely effective. And so that, combined with speaking to the people who did that, and then actually came back to my office, and Bessel van der Kolk had sent out a video, and he's a trauma therapist, actually a psychiatrist, and he was kind of imploring people to look into neurofeedback, support neurofeedback research. And I just thought, this is a sign, this is something I need to look into and learn more about.
This is a sign. I love that. So who benefits from neurofeedback? Because you were talking specifically about ADD and ADHD, and I know you said earlier sleep and anxiety and depression, but neurofeedback is also used by opera singers and football players. Who tell me about that side of things. Who can neurofeedback be good for, I guess?
So neurofeedback can really be beneficial to anyone. So CEOs, sports performers, Olympic teams have used neurofeedback to improve their performance. Elderly people who their brain functioning is declining or slowing down, early dementia people, benefit from it. So, as long as you have a brain and you want to improve it, pretty much, anyone can benefit from neurofeedback.
Can you tell me sort of the difference between neurofeedback and maybe the use of like psychiatric medicine? Because anyone can benefit from it, as you've said. But I'm curious, for folks who are experiencing symptoms of anxiety or depression, what's the difference in neurofeedback and maybe seeking out medicine, or can they be done at the same time?
So a lot of people come to me because they've taken medications and maybe they haven't responded to them well, or they're just not happy about the results they're getting. And so neurofeedback is kind of like improved science, improved techniques. And so one of the things that they find, or we find, is that usually people have a course in neurofeedback. So it may be 4 months, for example. They stop. They're, finished, completed. They've had symptom relief. A lot of people in the process will start to reduce their medications. Some people will eliminate medications completely. But what they found is it sticks. So if you do, research, a 1-year follow-up, a 2-year follow-up, people are still reporting benefits. Like
Yeah.
So kind of like braces, you get your braces on, they set, you take them off, pretty much your mouth is reset. You know, it may have some shifting.
Right.
But medication, you stop. Typically people, you know, aren't able to stop, or they have to slowly titrate down.
Right.
And typically they'll have, you know, depression or inattention, irritability, anger, anxiety.
Right.
So it's kind of a long-term treatment as well as more holistic and natural.
Okay, so a longer term effect than medicine. I'm curious where sort of research stands right now as far as neurofeedback. I know you have spent a lot of time doing the research, but like what's the cutting edge? What's happening next in neurofeedback?
So people are trying to compile more and more research because in general, neurofeedback hasn't had, you know, enough research. But that's changing over the last 10 years, 15 years.
Yeah.
People are getting more involved and doing more research projects. And it's very hard to have a control group with neurofeedback because they have, you know, everybody gets sensors on their head, but in terms of like, you know, what can they create as a sham, you know, to the control groups. That's been an issue. But it's, you know, probably the last 5 or 10 years, there's been a lot more research on it. Not only that, but fMRI they're using, which is kind of like real time. They can tell what's happening to a person as they're in the fMRI machine.
Right.
And they've shown that, you know, neurofeedback works, that it's changing the brain.
So what would you say to skeptics who say, you know, that's just a loadable? Like, what's your answer to them other than the research is there? Like, what else do you say?
Well, probably I'd say, you know, don't take my word for it, but look for yourself.
Yeah.
And there's a, you know, easy access or much more accessible on YouTube, for example, people that are doing research, you know, they can search some research on the internet that's out there by the different journals.
So seek it out yourself, I guess, is kind of your answer. Yeah.
Well, and we have some on our website, but it's very easy to. Recently, I started working with someone who has schizophrenia, so I wanted to kind of search up the information on that and found some great research. One woman worked with schizophrenics in an inpatient hospital setting, and it was effective for all of them. Most of them ended up leaving the hospital, being able to lead lives outside the hospital. So, yeah, and because of people like her that take the time and work with, in this case it was 70 people, clients, you know, you get some good information, some good research,
So other than, I mean, schizophrenia, right? But also sort of who are you working with now and what are they saying when they're done with their courses? What's their feedback to you? I guess we use feedback a lot, but you know what I mean.
Yeah. So a lot of people are, you know, super excited of their results. They're paying attention better. They're performing better. One 4th grader came to me at the end of her treatment and said, I'm on the honor roll. And I said, you're kidding me? And she's like, no. And she had never been on the honor roll. And she had, you know, struggled. And it was her first time that she had gotten honor roll.
That's so cute. It's really, really cute. So she's on the honor roll. I guess you probably can't tell us what you were seeing her for, but it had helped her to focus more. And so that's what had put her on the honor roll.
Yeah.
That's really sweet.
Yeah. Her ability to pay attention and focus was greatly improved. Yeah.
Do you see anyone just for performance enhancement kind of a thing? So like sports or theater or whatever else? And is that different in any way?
I do some of that, not as much. It's more like to focus on people who are struggling, you know, emotionally.
Right.
But it's similar. I mean, you know, people are we talk about the different protocols, what we're working on, what we're training. Everybody that comes in also does a complete symptom checklist. And so we're tracking. So, you know, on a scale of 0 to 5, do you experience any of these things? And it's probably about 120 different symptoms. Yeah, it's pretty comprehensive. And so, you know, after 8 to 10 sessions, you know, you rated this a 5. Would you change the number at all? And so people typically move from a 4, you know, to a 3 to a 2 to ultimately lower numbers.
I think I really just still, I know that it's brain training. I think I really just still don't know how it does it. Can you explain that in even simpler terms? I know I've asked this of you before, but how, after the diagnostic, how is it actually training your brain? How is it specific to you? How does it know how to be specific to you, I guess is my question.
So our brain is pretty intelligent, it's pretty adaptable.
Right.
And the way I explain it to people, I guess, is similar to like another organ, like your heart. So your heart can like skip a beat. Yeah. You might feel that. It might start racing. You might feel that. And so in some ways, your heart kind of has a function of its own. Like we can't just say, you know, stop beating so hard or, you know, or those kinds of things. So our brain is kind of similar. And so it gets into certain patterns that it likes to be in. Right. But a lot of times they're not very helpful, or our brain is not able to kind of regulate itself. So with brain training, a lot of times I'll just tell people, you know, you come in, for example, you have a lot of anxiety, you have a lot of probably beta wave, which is very fast brain waves, cycles per second. And we're going to ask the brain to inhibit that cycles per second, and we're going to ask the brain to do a more moderate frequency, like 12 to 15. So a lot of it is the computerized, you know, what I put into the computer, what protocol you're getting for your specific brain. Because if I speed up beta, you know, that's probably not going to be helpful to you. You'll feel more anxiety. Maybe you won't be able to sleep that night. But your brain figures it out, typically. So it's kind of like riding a bike. You know, your mom, dad, your uncle can tell you, this is what we're going to be doing. But ultimately, once you get on that bike, you need training wheels. Like you're unstable. But with time and practice, your brain's figuring out, this is what I have to do to kind of be on the bike and move forward. And then people progress, you know, training wheels come off, and then, you know, it's, and once you're able to ride a bike, if you haven't rode in 10 years, you can get back on a bike and ride it again. Right. So your brain has the capacity to remember what we're asking it to do. Right. And that's kind of what happens, you know, in everyday life. People start saying things like, you know, my neighbor left a note on my door to take my trash out. And normally I'd get really angry and think about, you know, maybe retaliation or some other angry thought. And now I just look at the note and say, oh, I need to take the trash out, okay. And they went ahead and do it. So a lot of like decrease in reactivity. I
cannot imagine not reacting to that note. Wow. That's really cool. So then how has this changed the way you move through the world as a person, not even as a therapist? Just like what's different since neurofeedback in your life?
Well, I think for me, you know, it's kind of twofold. For me, it's different since I did training myself. Right. So, for example, like when I was in elementary school, I had to see a reading specialist. And then as I went through school, reading was kind of difficult. Learning was difficult for me in general. And I ended up going to college, but I had to read and reread and reread, like about 3 times, probably what somebody else would read once. And since doing my training, I can actually read a book, stay focused on it, and remember and probably tell you, you know, a lot of what was in that book. Or things like, you know, I'd get on a plane and look around and wonder, why does everybody look so relaxed? Like we're getting ready to go on this plane, you know, and I'm like terrified. And now I can get on a plane and be like, this is cool, we're going somewhere. Let me look out the window, you know, see what's going on. So or ruminations, you know, thinking about things over and over and over again, not knowing that that is an issue. That was the only brain I had and that I lived in. And now I barely ever ruminate ever. So, but not only that, but, you know, working with people and clients, knowing how their lives can be different, knowing how they can see and experience the world just through a different lens almost, because their brain is more flexible.
You know, we only live with us, right? We only live inside of us. And that's something I spend a lot of time thinking about. It's just like, I can only ever know me. And I really can't know anything else, truly. Is it kind of cool to see that tangibly every day, to see how different minds can be? I don't know. That just seems like it would be really exciting to me.
It is. Yeah. It's super exciting, and it's very rewarding too, because like I said, you know, I feel like therapy and medicine are helpful, but again, it's up to a point, and this kind of, you know, takes people's progress further and longer lasting. Has
it changed the way you talk to people kind of generally?
It does. I'm much less likely to, you know, encourage somebody to take a medicine, or if, in terms of like, if they're feeling mixed feelings about it, I might let them know that this is an option for them. Like if they don't want to take medication and be on medication for long periods of time.
Yeah.
Because a lot of people, you know, 10, 20, 30 years, they're taking medications, which are hard on their liver, it's hard on their bodies. Some of the medications, you know, have long-term effects on their brain itself.
Yeah. Yeah. I'm curious, when should a person call you? Like, how do I know that, all right, it's time to try something different? At what point?
Well, I think, you know, I trust people to decide for themselves, like when they know something, you know, is not quite right, or that something isn't working as well as they'd like it to.
Yeah. So you really want this to be like a frontline treatment, not the thing that happens after years of therapy that hasn't worked, or the thing that happens after medicine. You want it to be top of mind for all kinds of people. Is that true?
That's true. I mean, there are some people, you know, the other piece is like counseling. You know, there are some people that come in for counseling, and as I'm working with them and they're making progress, you know, they're kind of addressing layer by layer.
Yeah.
But even, you know, people, for example, with ADHD or ADD, you know, if there's a lot of family tension, fighting, toxicity, abuse, I mean, that needs to be addressed as well, because our brain does interact with the environment.
Right.
And so we want, you know, but if you've, you know, if you've exercised, you've eaten well, you know, you've tried traditional things, or even if you want to try something other than medication, you know, I'd say it's definitely an option for a person.
I think the thing that's really cool about neurofeedback is that it can apply to anyone. So many of the things that we do in the Zoe office and that we're going to talk about in the show, and we already have talked about in the show, are specific to people who are hurting, which is, of course, a worthy thing to chase after, right? Like to chase healing. But the thing that's cool to me about neurofeedback is that it can kind of be for anyone. You can be neurotypical and you can still seek out treatment for neurofeedback, you know, just to make it your life easier for you and to make your brain get along with you better, it seems like. Does that feel true to you?
Yeah, and even, you know, like, for example, CEOs would say, my brain is great, like I don't need any training, but you know, if somebody is open-minded and participated in the training, they might notice that they feel a little bit more relaxed, or they're able to, you know, meditate easier, or they may be less rigid with their family members, and so, you know, even successful people, you know, can benefit from it.
It's such a cool thing. I know in your practice you deal with addiction fairly frequently. Do you see benefits of neurofeedback for recovering addicts, or have you not tried that yet?
Yeah, definitely. What they're finding is that most people with addiction issues have a lot of excessive fast wave in the back.
Okay.
Which means it's hard for them to relax. It's hard for them to get like quiet. It's hard for them to quiet their mind. And so there's a couple different protocols. There's one that's called the Penicillin protocol, which was widely researched and used mostly in the 80s, but it cut relapse rates by a huge amount. So,
really?
Yeah.
So what is special about that protocol?
Because it focuses on the back of the brain, and it's trying to kind of beef up alpha and theta, which is slower wave frequencies that their brains, so desperately need and are not producing.
Is the beta wave the usual troublemaker? It's sort of all we've talked about. I don't know if that's because that was on my map when you did my neurofeedback map, or brain map, sorry. Yeah. Is that just me? Am I the only beta troublemaker, or is it mostly beta who's making the trouble?
It can really depend. Like, so you can also have very slow wave activity, delta, which is like 12 to 4. People with trauma often have a lot of delta. They've found that the trauma memory is kind of in that slower wave.
Wow.
People that have had brain injuries or concussions or car accidents, they might have too much delta as well, the slow wave. So, the slow waves can also be pesky and create problems. Like a slower 4 to 7, 4 to 8 theta, that can be with ADHD in the front or mid part of the brain. So
ADHD isn't related to that quick beta wave? That surprises me, actually.
Well, actually, a lot of people have not enough mid, like 12 to 15. So they may have more beta and more theta, like kind of the other ends of the spectrum, and they need to beef up what's called SMR.
Huh. So just like all things in life, they need to find a middle ground, it sounds like you're saying.
Yeah. Well, and if you read anything, Daniel Amen, he's a psychiatrist that started out with spec technology, basically scanning brains, and he's written several books. And he's come up with the 7 types of ADD. So there are differences in ADD and ADHD in terms of brain patterns.
Right.
Some people can have 2 patterns. Some people might have 1. But, basically people are using the technology to learn more about our brains, how they function, and how they can be helped.
Do you see a future in which neurofeedback is used much more widely, or do you think that's going to take a little while? Just kind of curious.
Well, traditionally it's been a slow process. People accepting something that's different.
Yeah.
However, like yoga, who's been around for a long time, it's been widely practiced. I'd say in the last 10 years it's become more mainstream. So perhaps as people get more educated and learn more about it, and just even know, that it's an option for them, we might see changes.
Okay. Just kind of curious, I think a lot of us, we as a society rely really heavily on medicine. And so I'm curious if maybe there's a future where that's a last resort as opposed to a frontline treatment,
Yeah.
Yeah.
And I don't, there's a lot of, if you turn on the TV and watching a show, you'll probably see 3 ads for a medication by the time you're done watching it. So I think, mainstream right now, the mindset is medicine. And our brains are both chemical and electrical. And they focus mostly on the chemical part. This is focusing on the electrical part, which, it took a while to get there, but it's a great option.
Right. So then what is just kind of one thing you want everyone to know about neurofeedback? Like, what's the thing you tell people on the streets about neurofeedback? Like the most general, simplest nugget you got about it? I don't know.
It's a great choice, if you're open-minded, or I think, you won't regret it, basically.
Oh.
Like if I haven't had anyone, I don't think that's tried it, that hasn't said, I wish I had never done that, or it wasn't helpful at all.
Oh, so you've never had anyone say it wasn't helpful at all?
Well, once in a while, we'll get somebody that it doesn't seem like they're making progress. They don't seem to be responding.
Yeah.
And what we've found is that a lot of times it's because of a food sensitivity, an allergy, or an endocrine issue. And so that's, another layer into people learning more about their health, their eating, and getting checked for some of these things, which again are not necessarily westernized medicine. You're going to find that more from your holistic practitioner,
right?
People that are educated and know more about leaky gut, endocrine function, and how things kind of interact with each other.
Because we have more neurotransmitters in the gut than we do in the brain. I learned. Did I learn that from you?
Possibly.
Or
Julie, our nutritionist.
I probably learned it from our nutritionist. That's true. That's crazy that a food sensitivity could be the thing.
Mm-hmm. Yeah. And in fact, sometimes if people have what's called a low peak alpha, we'll suggest, go get testing for your thyroid or go get tested. And, a lot of my clients that learn more, when they're training with me or even beforehand, they find out, do they have some type of sensitivity going on.
Huh. So this treatment isn't just useful for our brains. It sounds like it's very useful for our bodies as well.
Yes.
That's really cool. Mm-hmm. So then I guess what is something that you have learned being a neurofeedback practitioner that we in this room, we watching at home, can take to our communities, to our neighbors, and use to care better for them? What have you learned that your specialized knowledge, right, that I don't have because I don't have your training, what of your knowledge can I take out into the world to be a better neighbor?
Well, I guess, understanding that most people's behavior is, a combination of their brain and their body and, kind of what they may be doing. So like I talked a minute ago about diet. So diet, exercise, alcohol, drug use. We know that exercise helps brain blood flow.
Right.
It helps focus. We know that what people put into their bodies and eat affects their whole brain and their body. COVID, we didn't really mention that, but they're doing their first neurofeedback trials with COVID patients because a lot of...
That's crazy.
Yeah, half of all people who are hospitalized, not that have COVID, but who are hospitalized, have long-standing neurological issues.
Oh, God.
So those are people that may have brain fog, trouble with balance. And this is, even viruses, things like autism, pandas, these things can affect our brain, and this is something that neurofeedback can help with. It can help basically get our brains healthy again.
Yeah. In this time of COVID, so since we're there, let's go there. What about burnout? I think as a teacher, I love my job. I don't want to get that twisted. But there are days, Ms. Cheryl, where I just don't want to. And I'm starting to recognize that as maybe a sign of burnout, right? Mm-hmm. I'm curious in this time of COVID where a lot of us are feeling this way, what can neurofeedback do for us, or can it do for us?
Yeah, a few months ago, I actually put together a trauma protocol or trauma release because the pandemic is traumatizing to all of us, like the amount of change that we're going through, isolation. So it has affected people. I think it's like people have increased their alcohol consumption. Yeah. One of the studies was 40% of people are drinking during the day, working from home. Whoa. People are getting angry and acting out. I've done the protocol myself, the trauma release protocol on myself, because I had gotten to a point, kind of feeling overwhelmed and angry and lack of empathy. Right. And, it can help with all those things.
So you maybe would recommend that protocol for folks who are watching who are teachers, frontline workers, caretakers, that kind of person right now?
Definitely.
Yeah. Wow, that's really cool. So the thing that we can take out into our communities is to be aware that everyone's kind of coming from somewhere different, but to also be aware that our brains are just as much a part of our body as the rest of our body, and we need to take care of our body in order to take care of our brain.
Exactly.
Just wanted to be sure I had all those things, so when I go into the world tomorrow, I can make sure that I take them with me.
In people who struggle, like, for example, the people who are on death row,
right?
You know, they do brain scans and they find that their prefrontal cortex isn't functioning the way it needs to be. It's kind of like shut down.
Yeah.
They're not able to see sequencing. Like, if I do this, then this and this will happen.
Oh, yeah.
So in Kansas, they've, you know, done work with people in prisons utilizing neurofeedback. So it's amazing, you know, of what it can hopefully prevent, but also treat.
Wow.
You know, in terms of everybody and humankind. Yeah.
Yeah. So in our last couple of minutes, the floor is yours. What cool things are you doing in neurofeedback right now? Are you offering any promos, specials, anything like that? All you. You tell me. What do you want everyone to know about your practice right now?
So what kind of happened, I guess, just naturally is that a lot of families will end up coming. So maybe a child comes for neurofeedback treatment, their brother or sister has some issues. Maybe mom and dad, because we know for the most part that if you're ADD or ADHD, the likelihood of one of your parents having the same issue is about 60%.
Oh.
So, you know, I end up treating families a lot of times. So typically I'll give people a discount if in terms of brain mapping, and if they have more than one person in their family participating in that.
Receiving treatment.
I'm actually adding probably some things to my treatment or my bag of tricks. There's something called AVE, which is audio visual entrainment. And that's lights, and it coaxes the brain towards a particular frequency. So, for example, you know, someone that's had a head injury or a car accident, or maybe a virus, or, you know, that's affected their brain functioning and they need to produce more alpha, you know, this is something they could rent and take home with them or do in session, where we're trying to coax the brain into producing a particular frequency that it may need.
Wow.
So that's it's often used in conjunction with neurofeedback. Yeah, some systems have them integrated into the system, but that's something that I'm looking and researching and trying on myself first before.
Yeah. And not to forget the trauma protocol, because I know that we've seen several public servants here at Zoe, specifically for that trauma protocol, right?
Yes.
During the pandemic time.
Yes.
Cool.
And the interesting thing, because I'm kind of a doubter and a skeptic like you.
Right.
So I don't have a problem with people questioning. I think it's kind of healthy.
Yeah.
I got together with some colleagues in August, and we did each other's brain maps. And my right side, T6 temporal, was like lit up, and it had never been like that before. Like, I've done, you know, probably initial brain map 5 years ago, then one again 2 or 3 years ago. So that to me was like telling me the pandemic, it's affected me too.
Right.
And that was a spot which, you know, too much activity can relate to like anxiety and.
Right. Yeah. I remember when you did my brain map, it was my pesky little beta waves going on. But you said something that I've never thought to be true about myself, that I was maybe having trouble focusing. And that's never been true of me. But I'm wondering if in the world of the pandemic, my brain is having trouble narrowing. I think maybe I've always been a very good multitasker. So it could be that I can do lots of things at one time and I can do them all well. But I'm curious if during the pandemic, focus is a thing that I am having issue with. And I see that now working with the kids. It's not even like, this is so bad sounding, it's not even like I can't focus. It's like I don't want to, you know? Mm-hmm. And that's never been true. But it's something you saw in my brain map during the pandemic. So I just think that was so interesting, because as soon as you said it, I was like, no, I'm really good at focusing. Miss Cheryl, what are you saying right now? But then as the pandemic has gone on, I've seen what you are seeing, which is that I kind of don't want to. And so I kind of don't. So definitely would recommend a brain scan during the pandemic for sure.
Yeah.
And this isn't something you can do virtually. That's still correct, right? Like, it has to be a one-on-one in-person sort of a situation, right?
Correct.
Okay. Protocols that you're taking, maybe we could talk about that.
So I'm wearing a mask. Anybody that's coming into the office is wearing a mask.
Yeah.
I've got like a HEPA filter. I usually have my windows open. More recently, I added a heater so people can be comfortable if we still have some airflow. Using a UV wand to kind of sanitize, and basically, we've always used rubbing alcohol and then another formula to just that they use in hospitals to desanitize. So just making sure, we're doing everything as safe as possible that way.
Right.
And I got everybody headphones, kind of like, I guess, teachers. So everybody gets their own headphones, because that's a part of training, is they're watching videos or playing, mostly watching videos. We have some games that people like to play, but you're getting the sounds through the headphones.
Right. Okay. So we are taking many different precautions, it sounds like, to make sure it's still safe to be together.
Yeah. Yeah, as many as humanly possible.
Yeah. And I know you've been very, very cautious as a person as well. So folks should still give you a call and see about these here neurofeedback protocols to get rid of that brain fog, help with that anxiety or depression, addiction, ADD, ADHD, or just improve performance. Yeah?
Yeah.
Yeah.
Insomnia, all kinds of things.
The sleep stuff. We didn't even get into all that. Well, we're nearing our hour, and we want to respect your time. So thank you so much, Ms. Cheryl, for talking with me, and we'll see y'all next week.
Thanks, Micah.